Hello, my name is Elizabeth Davis, and this presentation is about syphilis. Syphilis, what is it? Syphilis is a corkscrew shaped bacterium or spirochete called Treponema pallidum. When you think about syphilis, you can't help to think about the Tuskegee study of untreated syphilis in African American men that was an ethically abusive study conducted between 1932 and 1972 in Tuskegee, Alabama by the U.S. Public Health Service. Of these poor and illiterate men, the experiment group consisted of 399 infected and 201 uninfected, were the control group as a part of a study in exchange for free medical care and survivors insurance. These men were unaware of the debilitating and life threatening consequences with no choice to quit the Tuskegee study when penicillin became available as a treatment and cure. Over the last few decades, syphilis has not been spoken about, does not conclude that it no longer exists. Medical professionals who encounter cases are required to notify state or federal authorities. Unfortunately, many cases go undiagnosed or unreported. Each year, it has been estimated that over 35,000 people and rising of new cases. However, the people that are currently infected has reached about 117,000. Unfortunately, in 2016, new cases rebounded to 10.8 new infections per 100,000 people. Since 2019, there were 129,813 reported new diagnoses of all stages of syphilis. In the US, there is a syphilis epidemic that is on the rise among certain groups. Heterosexual African American men and women in the southern states, gay and bisexual men in large cities such as New York City and Los Angeles, drug abusers, gang members, and their female partners in regions of the country of illicit drug use. The risks of infection are among those who engage in unprotected sex, have multiple partners, HIV positive, gay men or men having sex with men, drug abusers sharing needles, and an infected mother to child transmission. Syphilis has four stages: primary, secondary, latent, tertiary. Be aware of the signs and symptoms of each stage. The primary stage of syphilis. During this stage, chancre sores will appear around the infection area around the genitalia, anus, or mouth. Chancre sores are usually but not always firm. They are also circular yet painless. Regardless of treatment during this stage, the chancres will last for 3 to 6 weeks and heal independently whether or not a person received treatment. However, some do not show signs or symptoms during this primary stage. Therefore, it is vital to seek treatment if sexual contact with an infected person has occurred. The secondary stage of syphilis. During this stage, skin rashes will develop on the palms of the hands and bottom of the feet. The appearance is rather rough with red or reddish brown spots. On some people, the rashes are faint. Unfortunately, lesions will make their appearance as well. They are usually large, raised, gray or white lesions known as condyloma lata. They are visible in the mouth, underarm, and groin area. Symptoms during this stage consist of fever, swollen lymph glands, sore throat, patchy hair loss, headaches, weight loss, muscle aches, and fatigue. Seeking treatment during this stage is vital because progression can prevent further damage. Latent stage of syphilis. The latent stage seemed like a relief because the signs and symptoms of syphilis have cleared up. Unfortunately, the infection is still present. Early latent syphilis is when the infection occurred within the past 12 months. Latent syphilis is when the infection occurred more than 12 months ago, which can also last for years. Tertiary stage of syphilis. Although the tertiary stage is rare, it can develop into a subset if left untreated. Syphilis can appear 10 to 30 years after the infection occurred, which can be fatal. It can cause severe complications to multiple organs such as the brain, nerves, eyes, heart, blood vessels, liver, bones, and joints. Let's talk about the syphilis types. What are they? Neurosyphilis, congenital syphilis, ocular syphilis. What happens when you contract those? Neurosyphilis is a complication of untreated syphilis that occurs 10 to 20 years after primary infection. Although 10% of untreated people will develop neurosyphilis, people with HIV account for the majority of cases. Now, congenital syphilis is caused when a mother passes the infection to her unborn baby, which can occur at any stage of her pregnancy. Pregnant persons should be routinely screened to ensure early treatment, reduction in the risk of transmission or complications. Now, ocular syphilis. It involves any eye structure, however, posterior uveitis and panuveitis are most common. Symptoms such as floaters, flashing lights, blurry vision, and ocular pain are subtle, but visual acuity may decrease to permanent blindness. Let's talk diagnosis. There are two types of tests that are used to diagnose syphilis. One is blood test, two is a cerebrospinal fluid. Blood tests are used to confirm the presence of the antibodies that the body produces to fight infection. Although these syphilis-causing antibodies can remain in the body for years, the test is used to determine a current or past infection. Cerebrospinal fluid is collected through a procedure called lumbar puncture, which is called spinal tap. Let's talk treatment. What type of treatment you need and what is recommended. Benzazine penicillin G in a single long-lasting dose of about 2.4 million units injected within a muscle has the capacity to cure patients in its early stages. It is recommended to receive 3 doses at weekly intervals in its latent stages. Unfortunately, the syphilis bacterium will not repair any damage done from severe complications to the organs. Treatment and follow-up. After being treated for syphilis, your physician will require you to take these necessary steps. 1. Require avoidance of sexual contact with anyone new until treatment is completed and blood tests indicate the infection has been cured. 2. Return for periodic blood tests and exams to ensure you are responding to the dosage of penicillin according to the stage of syphilis you were diagnosed with. 3. Notify all sex partners so that they can be tested and get treatment. And 4. Test for HIV infection. The best way of not contracting syphilis is through prevention. Let's talk about it. To avoid contracting syphilis, all sexually active teens and adults should abstain from sex or establish a monogamous relationship. Take the initiative to ensure all parties are vaccinated and tested regularly. Use latex condoms or dental dams for oral, vaginal, and anal sex. Furthermore, do not share any contaminated sex toys. Avoid recreational drugs because misuse of alcohol or drugs can lead to unsafe sex practices. Let's recap. Direct contact of a syphilis-infected person is through vaginal, anal, or oral sex. Sharing needles of drug abusers can also pose a risk of infection. There are many diseases in this world. Many other people have been careful just as well, or even more so, but have discovered they have contracted syphilis from someone unaware they were a carrier. Nevertheless, some people do not care to inform the other person that they are infected but intended to infect others. Do some research on diseases and be aware of the signs and symptoms. Check on or around the penis, vagina, or anus, lips, or in the mouth of anyone before relations. In addition, pregnant women with syphilis can transmit the infection to their unborn child. It is very crucial that all patients receiving treatment must abstain from sex until syphilis sores are completely healed, and alert all partners so they can seek and receive treatment as soon as possible.